We begin with a story right in our neighbouring country, Uganda, and there's an Ebola outbreak. And here in Kenya, the government has asked Ebola experts to be on standby after 2 cases were confirmed in our neighbouring country. Now, experts have also been posted 2 border points to screen those entering the country as the Ministry of Health seeks to forestall the spread of the deadly hemorrhaging fever. Let's begin our broadcast with our very own Enoch Sikolia.
Ebola is a horrific disease that ravages the human body, and the death of a 5-year-old in Kasese district of Uganda is just a reminder of the dangers the disease poses to the region. It is the first Ebola-related death in Uganda in the middle of a deadly outbreak in the neighbouring Democratic Republic of Congo. The boy died while undergoing treatment at a Ugandan hospital. He had exhibited Ebola symptoms, including vomiting blood and high fever.
A blood sample was drawn and sent for testing at Uganda Virus Research Institute very early on the morning of June 11th. And the sample tested positive for Ebola.
The Congolese boy had travelled from Congo on Sunday and entered Uganda with his family and sought medical care. The other 2 confirmed cases are the boy's 3-year-old brother and his grandmother. They are being treated at the Bwera Hospital Ebola Treatment Unit in the west of Uganda. Uganda's Ministry of Health says that 8 people who had been in contact with the family were being traced.
So the Ministry of Health would like to inform the public of the confirmation of Ebola virus disease in Kasese district, Uganda.
Indeed, the viral disease outbreak in the DRC had made the long-feared spring across borders into Uganda. The upsurge in Congo is both the second largest and deadliest outbreak of Ebola in history. With the virus having jumped into Uganda, Kenyan authorities are on high alert. The Ministry of Health says it has put in place measures of ensuring the disease is kept at bay. It says it has constituted a multi-agency Ebola Preparedness and Response Committee coordinating preparedness and response measures in the event of an outbreak. It has also established an Ebola rapid response teams comprising of medical specialists in disease control and laboratory scientists trained in testing for Ebola virus disease. The ministry has also activated Kenya's pool of Ebola experts who responded to the 2014-2016 Ebola outbreaks in West African countries.
Lazima tuweke mikakati.
Dr. Peterson Washira led a team of Kenyan health workers that provided medical assistance in Sierra Leone during the epidemic and tells us Kenya must do all it can to prevent the virus from jumping into its borders.
This is because Ebola presents like just any other a case that presents with fever.
Indeed, on Wednesday, health officers screened everyone and anyone who came into the country from Uganda through Busia and Malaba border points.
According to experts, Ebola spreads from one person to another through direct contact with infected blood, body fluids, and organs. One can also acquire it through direct contact with contaminated environment.
Like whenever somebody is sick, everybody will place their hand on them. And mind you, if they're having the wet symptoms, they are sweating profusely, then all of them are going to get Ebola.
Enoch Sikolia, Citizen TV, Nairobi.